With the recent changes in healthcare laws, it's important for those living with HIV to know about insurance and what it means for them. For some people, not having insurance may make it difficult and expensive to access care. Luckily, under the Affordable Care Act, everyone can buy insurance, including anyone living with HIV or other conditions. Similar to an umbrella, insurance is there when you need it to keep you covered. Your insurance plan is like a partner. You work together with your insurance plan to pay for things like doctor visits, medications, hospital bills, and emergency services. Parts you pay are broken into 5 different categories. The first is a premium, which is paid at a set time, for example, every month, to access medical services. The second is called a deductible, which is an amount you must pay for medical services before the insurance starts paying money. For some services, you pay a percentage or part of the total cost, called coinsurance, and insurance pays the rest. For others, you pay a set amount of money, a copay, every time you use that service. These payments are called out-of-pocket payments because you pay them out of your own pocket. Once you have paid enough money, you reach the out-of-pocket limit, and insurance pays 100% or all of the medical costs for the rest of the year. Insurance may help pay for a number of medical services and benefits. If you qualify for Ryan White and the AIDS Drug Assistance Program, ADAP, and have insurance, Ryan White and ADAP will not pay for anything the insurance pays for. But Ryan White or ADAP may be able to help with wraparound services such as case management and transportation. Check with your healthcare team to answer questions about what Ryan White and ADAP can pay for in your state. To help you find the best plan for you, a marketplace has been set up at healthcare.gov where many different insurance plans have been gathered. There are 4 main types of insurance plans sorted by what you have to pay every month: bronze, silver, gold, and platinum. Bronze plans have the lowest premium payments, but could cost you more if you go to the doctor often or take a lot of medications. With silver plans, you may pay a higher premium than the bronze plan, but you pay less for medical services. Also with the silver plan, you may be able to get help paying your costs, like premiums, based on how much money you make. Gold plans may be good for you if you go to the doctor often or take a lot of medication. Finally, platinum plans cost the most every month, but have lower out-of-pocket costs than the other plans. We're going to choose 2 plans to view as an example. Remember, these are just examples, so the payment details will not be exact and may be different between individuals. Meet Bernardo and Serena. Bernardo is on a bronze plan, and Serena gets her coverage from a silver plan. Now, to start off every month, they both pay a set amount of money to be insured, and this is called a premium. In this case, their premiums are paid monthly. Serena pays a little bit more than Bernardo every month. Bernardo and Serena go to the pharmacy to pick up their prescription medicines. They pay for them with cash out of pocket. This out-of-pocket payment goes toward their deductible, which is the amount they have to pay before the insurance starts paying money. The pharmacist tells them they need to have their prescription renewed by their doctor, so Bernardo and Serena each schedule a doctor's appointment. When checking into their appointment, they pay a small copay fee. But since Bernardo pays less in monthly payments, the copay costs him more than Serena. While in the doctor's office, they both have their blood drawn for testing. Serena pays out of pocket for a portion of the blood test before getting to her deductible. After that, her insurance takes care of a portion of the cost. Meanwhile, Bernardo continues to pay with his own money out of pocket because his deductible is higher and he has not paid enough to reach it yet. When the lab results come back, the doctor says they need some special tests and must go to the hospital for a few days. From this point on, Serena is sharing the cost of her hospital bed, food, and care with her insurance until she reaches her out-of-pocket limit. After that, her insurance pays for all of her expenses. Meanwhile, Bernardo pays all of the cost for 2 full days before his insurance starts to pay. In our example, Serena's silver plan costs more money per month in premium costs. But she had a lower deductible and a lower out-of-pocket limit than Bernardo's bronze plan. Because of this, her insurance paid a bigger part of her total cost than Bernardo's insurance paid. So as you can see, Paying more per month could save you money if you visit the hospital or clinic often. Remember, our story was just an example. In general, some plans may appear cheaper, but you should talk to a healthcare professional or insurance expert to weigh all aspects of a plan to see what is best for you. Insurance costs are different for every plan, even two of the same type. So look up the details or ask for help before you make a decision. Be sure to look at your plan's list of medications, called a formulary. Different medicines are divided into tiers, like these shelves, which are separated by price. It's important to see if your meds are listed and what tier they are listed on, because they could cost a different price under a different plan. And if you want to keep your doctor, you'll need to make sure they are listed in that plan, under the provider network. Finally, check the 5 parts you pay. Things like the copay and out-of-pocket limits are different from plan to plan, even if they are the same type of plan. It's important to look at all of the details and ask questions to see what's right for you. Congratulations! You are now ready to take control and find the right plan for you. The journey may not be easy, but there are people and resources to help you. Don't miss the chance to be a part of your own care. Find out if insurance is right for you, and if it is, what is the best plan? Talk to your healthcare team to find out when open enrollment begins so you can sign up for a plan. More resources are available online or by calling a marketplace representative. Visit healthcare.gov or talk to members of your healthcare team to get started.